you looking for a non-surgical solution to improve your erectile function as well as your overall sexual health? Then the PRP P-Shot is a solution for you. In this video, I'm going to explain exactly how the PRP shot works and how it's administered. Hi, I'm Stephanie Wolf, the leading sexual wellness expert and CEO of the Novus Center, a sexual wellness center in Studio City, California. So what exactly is PRP? PRP stands for platelet-rich plasma, and platelet-rich plasma is actually part of your blood. It's the plasma that contains your stem cells and your growth factors or your proteins that help to remodel tissue and bring new blood vessel regeneration, otherwise known as angiogenesis. Now, PRP is not new. It has been around since the 70s and has been used in aesthetics and musculoskeletal injuries and injections, but it wasn't until the 2010 when it started being used for sexual enhancement, otherwise known as the PRP P-Shot. And that means an injection in your penis. Just to clarify. So you may be asking yourself, why do I want to have an injection in my penis? Believe it or not, when you inject PRP into the penis, this is going to help regenerate and renew new tissue as well as new blood vessels. Anytime you're regenerating new tissue and new blood vessels, you're bringing that rich oxygenated blood to the penis so that you can get firmer, stronger erections. Not only do you see firmer, stronger erections, but you also have a heightened sensitivity with your orgasms. You're able to rebound quicker. In other words, you're able to have sex more frequently. The other thing it does, and we will go into a video later about this, it also helps with penile curvature in men who suffer from Peyronie's disease. I also want to discuss that it is nothing like the Trimix injection. I get this question all the time, is the PRP P-Shot equivalent to Trimix? And I did do another video discussing the difference between the two, but Trimix is like a VIAGRA, but for your penis. So you're going to be injecting this medication before sexual encounters, and it only lasts for 4 hours. Whereas injecting the PRP P-Shot is all about penile health and penile recovery, meaning it's not going to give you an erection immediately and only lasts for 4 hours, but it's actually restoring and repairing the tissue and the blood vessels of your penis so that you don't have to use the Trimix. Now, once you do this PRP P-Shot, how long does it last? Well, everybody's a little different, but from what I've seen, most men will come back within a year or two for another PRP P-Shot. Remember, we're always aging, and our tissue is always aging, and we're always declining. So it just depends on how fast that tissue is aging, on how frequent you need to have that PRP P-Shot. Another question I get is, how long until I start to see the benefits? Again, everybody's a little bit different, but some patients will start to notice the improvement of their erections or the improvement in their sensitivity within 3 to 4 weeks. But I always tell patients you have to give it a full 90 days because it takes a full 90 days for your tissue to regrow, for your new blood vessels to regrow. And again, everybody's a little bit different and they're going to have a different speed at which they grow. Now, what is the success rate? Believe it or not, the success rate is about 80%. And the reason it's 80% is because some patients actually have other underlying health conditions. Maybe their blood pressure is under control, or their diabetes is under control, they're smokers, or maybe they're on a list of medications that inhibit their libido, their sexual drive, or their ability to get an erection. So unfortunately, if you're in that 20% who didn't get results from your PRP P-Shot, I highly recommend that you go see a sexual wellness expert so that they can figure out exactly what it is that you need for your next steps. Here at Novus, when you purchase a PRP P-Shot, we always give you a complimentary hormone consultation because we believe in the person as a whole. We want to make sure that we're looking at all avenues. You may have heard me say it before, but erectile health really is 3 pillars. It starts with the brain. The brain is very important. So if you are taking any medications that affects the brain, such as antidepressants, anti-anxiety, seizure medication, that's going to alter or inhibit your erectile function. Number 2 or second pillar is going to be your hormones. Hormones play a huge part, and the reason why is because not only is it your libido, but you need testosterone to produce nitric oxide, and nitric oxide is your most potent vasodilator, which is going to cause vasodilation of your blood vessels so that you can actually get an erection. And then of course the last part, or the last pillar to getting an erection, is your cardiovascular. That's strictly blood flow and how much blood, rich oxygenated blood, you're feeding to that tissue to repair the tissue. So if you're in that 20% that didn't get the results that you were looking for with the PRP P-Shot, more than likely the issue is going to lie in one of those 3 pillars, which is why it's important that you seek out a sexual wellness expert so that they can help you and guide you towards erectile function. Another question I get is, will the PRP P-Shot make my penis bigger? That's a valid question. It's a very good question. I don't want to say yes or no, but what I will let you know is that it is part of the Novus growth protocol. And if you actually think about what the PRP P-Shot is, again, it's your liquid gold that contains stem cells and growth factors, and it's being injected into this tissue. And the reason it's being injected into this tissue is to enhance that tissue growth and new blood vessels. So the more blood you have, the more tissue you have, you're just going to have a more healthier penis. And I'm hoping that answers your question. Is this procedure covered by insurance? Unfortunately, it is not. This is a cash pay price. So now let's talk about how the PRP P-Shot is administered. Well, here at Novus, we combine all of our PRP P-Shots with shockwave therapy. So anytime you call into the office and you schedule an appointment for a PRP P-Shot, you will be undergoing a shockwave treatment. And the reason why is because we've actually seen improved success rate when we combine the two. So really, it's to benefit you and your outcome. I like to think of it as a farmer. If a farmer wants to plant a new seed, he's going to plow the soil first to get it prepared. That's how I think of shockwave. I'm going to plow the soil first before I plant your PRP seed into that tissue. And then of course, here at the Novus Center, we always send you home with your penis pump because now I want to water that new seed with rich oxygenated blood. So I did another video talking about the specifics on the penis pump and how it works, why it's important, and how to administer. I will include that link in the description below, but it is part of our protocol. So getting back to it, when you come into the office, you will have a complimentary consultation with one of our patient care coordinators. They will walk you through everything you need to know. They will answer all of your questions, not only about the shockwave therapy, but about your PRP P-Shot and the penis pump. Then they will have you apply a numbing cream. You will put this numbing cream around the penis and you will numb for about 30 to 45 minutes. Once you've sat for about 30 to 45 minutes, then it's time for you to meet your practitioner. She will come in and she will administer another type of numbing agent called a nerve block. And this nerve block is using strictly lidocaine, and it's 2 very small needles. They don't go into your penis, they go into the suprapubic region, which is just at the base of the penis. There she'll give you that lidocaine so that you can numb a little bit more. Then she will draw blood from your arm and she will put it into the centrifuge. It takes about 10 minutes for your blood to spin, and this spinning is going to separate your red blood cells from your platelet-rich plasma, the liquid gold that we're talking about. So once she's done that, she will draw up this liquid gold into 4 syringes, again with small needles. I promise you they're small needles. And then she'll come back into the room and she'll administer your shockwave therapy. Shockwave therapy takes about 15-20 minutes. So by then, you've been numbing with the cream for about an hour and a half, and you've been numbing with your lidocaine block for about 30 to 45 minutes. So you will be numb. I am telling you, you will be numb. From there, she'll wipe you clean with alcohol. Remember, this is a procedure, so we want to make sure that you are clean. And then she will administer the injections. There will be one on the right side down by the base, one on the left side down at the base, and then again, one on the right, one on the left, a little bit higher into the corpus cavernosum. The shots themselves literally take less than 2 minutes. And most patients don't feel a thing. If you do feel something, usually it's pressure, and it's just pressure because there's fluid going into the cavernosum. Now, there are no side effects to the PRP P-Shot because, again, we are using your own blood, but you can have some bruising from the actual shots themselves. So if you do have some bruising, that bruising will last about 2 to 3 days, and then it goes all by itself. You don't have to worry about it. If it lasts longer than 2 or 3 days, then definitely call your healthcare provider and let them know what's going on. As far as anything else, the numbing cream takes about 4 hours, and then it will dissipate and you'll be back in business. We just ask that for the next 24 hours, you don't go into the pool or any hot tubs, saunas, no sex. Again, just for 24 hours because you did just have some injections into that private area. And I want to make sure that there's no bacteria that settles in or any kind of risk of infection for having that skin open. If you have any further questions, please feel free to reach out to us. We're more than happy to answer any questions you have. You can leave questions in the comments below. And again, the P-Shot can be purchased alone, but it is also part of our Novus growth protocol. Here at Novus, we also have the option of adding exosome stem cells to your PRP P-Shot for further enhanced results. I will be doing another video discussing that treatment next. But again, if you have any further questions, please feel free to reach out to the clinic. We're happy to answer any questions, or you can leave a comment in the comments below.